Good morning, everyone, and welcome to Healthy Starts, sixth annual legislative breakfast. My name is Sherelle Fulton, and I am the community lead for Healthy Starts Consortium. This year's theme is Whole Caregiver, Whole Child, Shaping Policy for Early Wellbeing. This year, I would like to start our event by having a short moment of silence for my former colleague, Latavia Michael, who passed unexpectedly last year. She was a wonderful mother and a champion advocate for maternal and child health. She is deeply missed. Please allow us a few seconds. Thank you. We will also like to start our breakfast this year, sending our many thanks and appreciation to Ms. Thelma Jackson, former Senior Program Manager and Healthy Start lead for our consortium, as she is now retired. She co-created the Legislative Breakfast platform since its inception. Ms. Thelma served Healthy Start courageously for over 16 years, and her guidance and presence will be missed. Thank you, Ms. Thelma. I now welcome Healthy Start Pittsburgh's CEO, Jada Sherrill, to the stage. Jada?
Thank you, Sherelle. Good morning, everyone, and welcome to Healthy Start's sixth annual legislative breakfast, Whole Caregiver, Whole Child, Shaping Policy for Early Wellbeing. I'm so excited that you're here with us this morning to hear how perspectives from multiple segments of our community shape our work and shape policy. Caregiving is a universal language. Every one of us has experienced the need to be cared for or has cared for someone else. In the context of today's legislative breakfast, we are focused on sharing the importance and implication of support for all caregivers of children ages 0 to 3, strengthening relationships between medical providers and community, and supporting the most vulnerable years of a child's life by proactively seeking to close gaps. Every well child visit is more than a check on a baby's growth. It is an opportunity to support the emotional well-being and health of parents and caregivers. Policy shapes so many aspects of how we are able to show up as caregivers. I want to thank our legislators, our legislative experts, our community members, and our medical providers with us today. I want to thank those of you who have taken the time to join us as observers. And please don't just be an observer. Make sure you participate in the chat. We love the active participation. Also, this event and the work of Healthy Start is not possible without funding support. Thank you to our sponsors, Highmark Whole Care, Presley Ridge, and Planned Parenthood. Lastly, thank you to our Healthy Start Consortium members, our staff, and our tech production team. At this point, I want to introduce Healthy Start's Director of Strategic Initiatives, Yasmin Bennett-Kelly.
Thank you, Jada. Good morning, and thank you all for joining us for Whole Caregiver, Whole Child. At Healthy Start Pittsburgh, we believe that when families are supported, communities thrive. Our mission is to ensure every mom, baby, and family in Allegheny and Westmoreland counties have access to the care and the resources that they need to live healthy, fulfilling lives. Our policy platform reflects what we hear directly from families every day. It's rooted in community voice and focused on addressing the barriers that drive disparities in maternal and child health. First, access to affordable, high-quality healthcare is essential. We support policies that expand telehealth, improve patient-provider relationships, and ensure doula services are covered so families can access respectful, culturally responsive care. Second, workplace policies matter. No caregiver should have to choose between their health and their paycheck. That's why we support stronger breastfeeding protections, paid family leave, and raising the minimum wage. Third, supporting the full family, including fathers and partners, is critical. Families deserve the information and resources to make informed decisions about their care and well-being. And finally, healthy families need healthy communities. Clean air, safe water, and walkable neighborhoods are not luxuries. They're essential to family health. As we navigate today's policy and public health landscape, Healthy Start remains committed to centering community voice, advancing equity, and supporting families across the full continuum of care. It is now my pleasure to introduce a leader who shares this commitment. State Representative Elizabeth Fiedler has represented the 184th District in Philadelphia since 2018. Before her time in office, she spent a decade as a public radio reporter, amplifying community voices and holding power accountable. As a mother of four, she is a strong advocate for public education, maternal and child health, mental health, affordable housing, healthcare, and childcare. As chair of the House Energy Committee, she is also leading efforts to build a more sustainable and equitable future for Pennsylvania. Please join me in welcoming State Representative Elizabeth Fiedler.
Good morning, everybody. Thank you so much for having me. I am State Rep Elizabeth Fiedler. I have to thank you so much for having me and also for the warm introduction. Every time I hear mother of four, I do pause for a second. It's a bit stunning. About a year ago, I had twins in addition to the two older children I had. So busy life, but very grateful and so grateful for all the work that you all do. As you heard, I'm state representative for the 184th Legislative District, so I'm joining you from South Philly. I want to say hello to my colleagues from out west who are on as well. And thank you to Healthy Start for enjoying me to share just a few words today. I'm honored to be speaking alongside my colleagues, Rep. Powell and Rep. Abney, and the many experts and advocates who are working to make a bright and lasting future for Pennsylvania's next generation. And I'm really glad that we are here to focus on caregiver health and mental health, two issues that are incredibly important to me as a lawmaker and as a parent. My district in South Philly covers a lot of area. The Stadium District, so where the Eagles and the Phillies play, iconic food spots, cheesesteak spots, 9th Street Italian Market, and so many households and families, almost a quarter of whom have a child under 18 years old. My district office is located right in the center of this, really accessible by bus, other forms of mass transit, and right there in the community. We want to make it as easy as possible for families and caregivers, whether they're caring for some of the youngest residents or some older residents or residents dealing with physical challenges. We want them to be able to come to our office and receive services and assistance with programs like Medicaid or housing resources, food distribution. And we're always trying to help them go that extra step and make sure they're taking care of themselves as well. Since taking office, children and caregivers have been at the center of my legislative work, and they really do guide and motivate me along the way. I'm proud to be fighting alongside my colleagues for funding for public schools, advocating for the working families tax credit, supporting better pay for early child care workers who deserve the biggest shout out. So underpaid, so underappreciated by our world, but so appreciated by those of us who know how much they do. And my legislative work, along with the amazing leaders of the PA Momnibus, we were able to get through a bill to increase postpartum depression awareness and treatment. And that for me has been one of the greatest accomplishments and things that I am most proud of during my time in the legislature, working with the Black Maternal Health Caucus and trying to get some of that very important legislation over the line. I understand deeply how supporting caregivers intersects with so many of Pennsylvania's needs. We can't have a functional and thriving state if we aren't supporting our youth and the caretakers who keep them safe, educated, and healthy. As I mentioned, I have 4 kids in my home, including almost 1-year-old twins, and these issues really do hit hard for me. Raising my children is a joy, it's an adventure, and it is also stressful and difficult. When I drop off my older kids at our neighborhood public school and my twins at the local daycare, I get to talk with a lot of other parents, grandparents, aunts, uncles, and guardians. They love their kids, they're doing their best, and they are trying hard. But they're struggling in this society that we have, in this system that undervalues people. in this system that expects folks to be working 1, 2, sometimes 3 jobs just to pay the bills. On a personal note, I want to go back to the piece of legislation we're able to get through as part of the Momnibus, because I feel like it's appropriate for this audience. After giving birth to my oldest child, who's now, I can't believe it, 11 years old, I experienced pretty intense postpartum depression. At the time, if you had said, "What's going on, Liz? Why are you feeling that way?" I wouldn't have had the words to tell you. I didn't even know at the time, but I knew something was deeply, deeply wrong. So I'm here to say that the more that we can talk about postpartum depression, anxiety, and mental health struggles in general, the more we can increase education, awareness, and certainly treatment. I believe it would be better for our entire Commonwealth, and certainly better for caregivers and those they take care of. Even with the strides that so many have made to try to normalize mental health and caring for ourselves, these challenges still remain shrouded in stigma. I can tell you that personally. And even when people understand issues and seek help, often they can't afford to pay for or access the healthcare that they need. Almost 42% of Americans live in areas without enough mental health professionals. If you don't know that personally, you may have a friend or family member who has struggled to access mental health care. And as we know, these gaps have serious fatal consequences. Mental health conditions are the leading cause of pregnancy-associated death in Pennsylvania, and for Black mothers, the rate is twice as high. That is simply unacceptable, and we must continue to do everything we can in the Commonwealth to change that statistic. I want to give a shout out to State Reps Mays, Cephas, and Curry, who have been instrumental in doing this work in the Commonwealth and really have made Pennsylvania a national leader. The current state of affairs is an unacceptable tragedy, but it doesn't have to be our reality going forward. I'm proud to be working with my colleagues in the legislature to pass bold legislation and policy that puts people first, especially caregivers, and that recognizes racial and economic disparities and works to achieve equality for all caregivers. When I became a mom a decade ago, I covered mental health care as a reporter for the NPR public radio station here in Philadelphia, WHYY. I got to travel around Pennsylvania talking to moms and moms-to-be about their interactions with the healthcare system, they often brought up mental health challenges and their inability to get the mental health care they needed. In 2019, First Lady Tammy Murphy in New Jersey launched the maternal health campaign, Nurture NJ. I bring that up because I was still struck the first time I heard First Lady Murphy tell her story. She was motivated to tackle care disparities she witnessed as a new mom between wealthy white families like hers and Black and brown communities that made up the majority of New Jersey's maternal mortality rate. Her campaign oversaw 43 new laws, which as someone who works in the State House, I have to tell you, 43 is a stunning number, and $60 million in the state budget for maternal health initiatives, including expanded paid family leave, implicit bias training, and a maternal and infant health innovation center. This is something I would love to see us replicate in Pennsylvania. As a result, New Jersey leaped from 47th in the nation for maternal and infant mortality to 29th in just a few years. 29th is still too many deaths, but it is progress in a short amount of time. And I see no reason Pennsylvania can't make those strides and save lives as well. There's so much variance in maternal health outcomes across the state, but models like New Jersey's, our neighbor right over the river, give me hope. They've been able to drastically improve lives and prove that smart public policy paired with targeted investment can save lives. I believe our legislature can achieve this with bipartisan support from all corners of the state and leadership within the House and Senate. As federal cuts to Medicare and Medicaid take effect, we also know that poor and low-income caregivers and those in rural areas will be some of the hardest hit. As lawmakers, we have to think about what we can do at the state level to protect Pennsylvania residents from these attacks on their health, their well-being, and their health care. Again, I am so grateful to be working alongside colleagues who are leading the way on this. Rep. Gina Curry has introduced a bill to create access zones to address rural health deserts. Rep. Latasha Mays has legislation that would make blood pressure monitoring eligible for state medical assistance coverage. These may sound like small changes, but hypertensive disorders of pregnancy, HDP, are a leading cause of maternal, neonatal, and fetal mortality, with Black mothers having the highest mortalities at over 40 per 100,000 live births. Imagine how many lives, how many sisters, how many mothers, how many neighbors could be saved if everyone could access and afford the care they need. These are just a few of the bills being considered right now in the State House, and that's not to mention legislation designed to support new fathers or to better support families dealing with substance abuse or to make it easier to breastfeed and pump outside the home. Every caregiver has their own unique needs, so we need more than a one-size-fits-all policy. We need a comprehensive approach that considers all types of caregivers and all types of needs. As a full-time legislator, I am hopeful and determined to be part of making all of that happen. I am so grateful for the work of groups like Healthy Start, who are supporting caregivers through a comprehensive whole person and whole child approach. Mental health, as we know, is health. Mental health care is healthcare. And I look forward to learning from and speaking with all of you to work towards this shared goal of improving the lives of caregivers and children. Thank you again so much for having me. Thank you for your work, and have a wonderful day.
Thank you, Rep. Fiedler, for those remarks. My name is Art Terry. I'm a proud member of this consortium, and I'm also the Perinatal Health Education Coordinator here at Health Start. And in the interest of continuing this conversation that we're having today, I'm going to take the pleasure right now and introduce our first testimonial speaker. She's a mom, she's a coach, proud coach of the Alderdice High School girls basketball team here in the city. She's a mentor. She's a former standout student athlete herself in her career way back at Albert Gallatin. For some of you who are local here in the Pittsburgh area, she scored like almost 2,500 points. That's a lot of points, guys, in high school. Okay. But more important than all that, she's a teen parent advocate, someone who has a great deal of knowledge and information about the subject that we're talking about today. So at this time, I'd like to welcome Ms. Ellen Gilliard to the stage. Welcome, Coach G, to the sixth annual legislative breakfast.
Thank you, Mr. Terry, and thank you everyone for having me. I didn't realize Mr. Terry knew that much when I played. If you know me, you know this is not the most comfortable setting. However, if it's to advocate for our students and student athletes and those who are pregnant or parenting that are teens, I'm all for it. I work at Brashear High School. I'm a teen parent advocate with the ELECT program. I have an office at Brashear and I have an office at Perry where I service all students, regardless of their background, with getting supports needed for their child or while they're pregnant. I work with fathers. I work with students who are part of the ESL community. I do a lot of things in different capacities with them. The biggest theme I have with my students is mental health. When we try to focus on the whole caregiver and parenting models, a lot of the things that I tackle is their mental health and how they're feeling about themselves and why they're feeling the way they are about themselves. What traumatic things have occurred in their lives. I tend to focus on that a lot because, you know, students, children from 0 to 3 years old are sponges to how we feel in our energies. So I try to tackle that as much as possible with self-esteem exercises, anxiety and anger exercises. We talk about depression. We talk about all those things. Fortunately, I have a great relationship with Healthy Start via Mr. Terry, who is literally always a phone call and a text away to come and deliver some services that are a little bit out of my reach, if per se. I have students with various different backgrounds. I have students who are refugees, who have been sex trafficked, who have witnessed the most terrible things that can only imagine. So I can't attack or critique their parenting skills whenever literally we have to focus on the person and try to give them all of the resources needed and all of the tools to try to um, reduce their trauma and give them various outlets to um, manage and heal from all of those things. I have most of my students are victim or witnesses of violent sexual assault. Most of them are witnesses or victims of domestic violence. And a lot of times in the high school setting with their teachers, they're presented as students who have attitude problems, who are chronically misunderstood, who literally have to be accompanied by security to come to my office. And I'm just like, you need security to come. They're constantly misunderstood. My goal and what I usually do with most of my students is advocate them in the school setting, telling their teachers with their permission, hey, I have a student whose mother who's recently going through um, breast cancer and treatments, and that particular student is a little bit antisocial sometimes and is constantly getting yelled at. With their permission, I advocate and make sure they're treated fairly. Title IX is my best friend in these calls, in these situations, and I'm very much so willing to do all things to protect them by not allowing them, though, to have an excuse for acting the way they do. I try to give them tools to advocate for themselves, to let them know, hey, sometimes you can share a little bit about your story so that they understand where you're coming from and so that you can get a little bit of support from the school services that is offered. A lot of times, my students are not welcoming to anyone and they don't want anyone to know their story. And it's very hard for me because once I get to know them and I know some of the things that I have to offer, they need something else. It's really hard to get someone else to come in and for them to gain trust and insight as well. So once again, I'm very thankful for a healthy start fulfilling that for us. Like Mr. Terry had mentioned, I do coach. I also coach flag football now. So I actually had parents, teen parent athletes who have played for me, which is awesome as well, who've had their babies on the sideline and for senior night. So I try to attack them with as much assertive nurturing as possible, but I really tap into the mental health because I think without that, we can't unlock our fullest potential. And I think not allowing our students to have a platform to speak and to for me to active listening to that, listening to their problems and their pain, and as well as trying to navigate how they were parented and how they don't want to parent themselves the way that sometimes they have been parented with their children is pretty awesome. But that's pretty much what I do, and that's what I provide. Mental health access is extremely critical and important. I can't stress it enough for especially the students that walk in through my doors. Um, Thank you, Mr. Terry, for having me again, and thank you everyone for listening and for everyone's support. It's much appreciated.
All right. Well, I guess it's up to me. Thank you so much for allowing us to take a peek into your life and experiences as a teen parent advocate, Coach G. That takes a massive amount of trust and bravery, and I certainly look forward to witnessing your advocacy efforts going forward. With that, I'd like to welcome our 2026 legislators panel. First up, we have Representative Lindsay Powell, who's elected to the PA House of Representatives on behalf of the 21st Legislative District here in Allegheny County back in 2023. She has fiercely advocated for the improvement of mental and maternal health services during her time in office and continues to represent on behalf of families here in Pennsylvania. Next up is Amanda Neitrar, and she is a dedicated community member with a strong understanding and background in local legislative efforts. And she presently serves on the Governor's Advisory Committee for the Office of Alzheimer's, Dementia, and Related Disorders, representing unpaid caregivers. She's dedicated to supporting and leading her community through authenticity while also being a sandwich caregiver. Now that we've learned a little bit more about the powerhouses leading the way for comprehensive mental, maternal, child, and family health right here in Allegheny County and the Commonwealth of PA, we can go ahead and get into today's discussion. I would also like to note that we may have some insight from Representative Fiedler at some point, so stay tuned for that. With that being said, the first question that I have for you, Representative Powell, is what current state level bills and initiatives are most directly addressing mental health resources for children and caregivers?
Absolutely. Well, thank you all so much for the opportunity to share a little bit about what we're able to fight for in the House. As said, my name is Lindsay Powell, and I have the honor of representing the 21st District, which includes the city neighborhoods of Lawrenceville, the Strip District, parts of the North Side, as well as Shaler, Millville, Etna, and Reserve Township. I think, as we've said on this call, we have a really long way to go. Pennsylvania, unfortunately, finds itself leading the pack at being the last of the states to enact really important legislation as it pertains to maternal health, mental health, and being progressive and intentional in making sure that those that are most vulnerable amongst us have the resources that they need to survive and thrive. We struggle oftentimes not just putting these programs together, but making sure that they're implementable in a way that community can access them. And so one of the things that I've been a very strong advocate on is ensuring that as we're putting forward these bills, as we're talking about increased mental health spending, that we're making the actual guidelines to access these funds for groups like Healthy Start and so many others that are listening to this call or represented on this call, making sure that those dollars that we put out into community are accessible. Not to get into a little bit of the kind of like minutia in the granular space, but a lot of our programs at the state level are reimbursable. And so for a lot of these organizations that are on the ground, that are boots on the ground doing this work, putting up the money first and then trying to get reimbursed is incredibly uh, inaccessible. It makes it so that these grant dollars aren't even really incredibly helpful. But to your question on mental health supports, one of the things that I'm really proud of is our advocacy, ensuring that we have expanded opportunities for care in schools. In our last budget address, our Governor Shapiro, really lauded and pushed for the need to have expanded counselor care in schools and more mental health resources and supports. We know that our young people are struggling. And I don't want to say that the pandemic really highlighted this issue, but I think it laid bare for a lot of people who were at home, realizing that at school, this is where a lot of young people get their supports if they don't have it at home. And so making sure that we have extended funding at the state level for these types of uh, for the types of mental health supports in schools is incredibly important. And our legislature is continuing to fight as this budget cycle progresses to make sure that that is visible in our public schools across the state.
Thank you so much for that information. I think I'd be doing us a little bit of injustice here on the legislative breakfast since our community is watching. I would like to ask if you know of any bills or initiatives that are currently being proposed that folks could take a look into, things that they should be adding to their radars. What should we be aware of?
So one of the things I think is incredibly important to look at is how the actual dollars within departments are being spent. So specific bills that you can look forward to is the National Counseling Compact that was passed out of the Senate, the Pennsylvania Senate, which would allow for licensed professionals to provide services across state lines. One of the things that we constantly struggle with in Pennsylvania is that in other states, if you are certified in another one, it's very easy for you to get recertified in that state. We don't have the same ability here. And so that really speaks to the amount of mental health counselors that we can have in the state. So that bill is incredibly important. I think also when it comes to specific funding bills, Representative Probst has a bill, and this is where I falter. I never remember the numbers because there are so many of them, but Representative Probst has a bill as well to expand services for 988, which is incredibly important, a 24-hour assistance line to provide mental health supports and resources to those who call. There is a bill that has increased spending for that. We've also passed legislation out of the House to allocate $100 million in funding for mental health supports. The problem, unfortunately, in Pennsylvania, as I'm sure we'll get into later on in this call, is we have a Democratic controlled House and a Republican controlled Senate. And so the frustration for us in the House is bills get passed and they sit in the Senate waiting for consideration. And oftentimes these bills that we know are so important to our communities, they don't get voted on, they don't get sent to the governor's desk. So within that $100 million I talked about, there's a myriad of different buckets for different things. So I think it's 34 million for workforce development and retention and behavioral health, another 30 million for criminal justice and public safety programs, suicide prevention, integrating behavioral health into primary care. But I'm happy to actually find that bill number and send it over to you as well.
We definitely appreciate that. This work could not be done without you, and being able to share that information back into the community is part of why we're here. We understand that the grassroots support all the way up to when it reaches your desks and the governor's desks is a very intricate process. So we very much so appreciate it. Before we continue, though, I would like to welcome PA State Representative Arian Abney, who was elected to the PA House of Representatives on behalf of the 19th Legislative District. He's also a proud father and subsequent advocate for dads, moms, and families across the Commonwealth of PA, and he's actively serving as a member of the Black Maternal Health Caucus. So Representative Abney, thank you so much for joining us. We are just getting into the meat of the conversation. So the next question I have here is actually for you. How can public policies better support caregivers who may struggle to access mental health services because of things like transportation, insurance limitations, costs, etc.?
Yeah, well, first and foremost, thank you for having me, and I am honored to be here. There is no school today for Pittsburgh Public Schools, so I am multitasking here today with my oldest son who is here, and I'm taking a half mental health day myself too. So I appreciate the topic and the conversation as a person who is in the workforce, but also is a full-time parent as well. So I'm gonna get you a pouchy in a second. You want to say hi to everybody?
Hi.
Oh, okay. Can you go back on the sofa and I'll get you something in a second? All right, appreciate it. So my background, just by way, and I apologize for being late. My calendar said that this started at 9:30, so I apologize if I was a little bit behind. But I see my colleague, Representative Powell, has given you some background and context about some of the work that we're doing up in Harrisburg. But for those who do not know me, so my background is I'm a social worker. I'm the actual only degree carrying social worker in the legislature currently. So I have a master's degree from Pitt. And so I approach the work that I do through the lens of sort of this helping profession of social work. And so when I think about policies that we can be looking at in Harrisburg to help to improve the mental health of folks, caregivers, and looking at things like you mentioned, transportation. I know transportation was a big topic of discussion in last year's budget. We weren't necessarily able to come to figure it out in the budgetary process, but we were able to figure out a way to provide some resources for the two largest transit agencies in PRT and SEPTA to be able to continue to provide services without major cuts, at least through next year. We talk about the conversation around education. I know in last year's budget, even though it was late in November, we put in $100 million for school safety and mental health supports. I actually have a bill that I'm working on right now for school mental health screenings that will require our school districts to go through the process of screening their individual schools to make sure that they have the necessary resources, the capabilities, capacities, and the staff, including social workers, to be able to provide mental health screenings for students And when they go through that assessment process, if they find out that those schools do not have the tools and the resources that they need, they then can apply through the Department of Education for grant funding to be able to get the resources they need to do that. But as when I jumped on, Rep. Powell mentioned, it would be great if we're able to take that bill that I introduced and actually get it passed out of the House, which I feel confident we'll be able to do. But there's no telling what happens when it sits over moves over to the Senate. So there's a lot of things that we can do legislatively, but what I tell folks all the time is that there's this balance between like co-governance, right? So there's so much that we can do at the state level, especially when we're in divided government. But a lot of what we do is we provide resources, right? So a lot of the resources around mental health services that we provide through DHS goes directly to the county Department of Human Services, and they are the ones that actually are implementing the programs and providing the direct services to the folks in our region. So I'll pause there because I know there's a lot of questions, but hopefully that's enough of a intro for you all.
I think it certainly is. It allows us to see a little bit more into not only what's happening at Harrisburg, but the intricacies within the process, right? We've heard from Rep. Powell as well as you that when things move over to the Senate, it may be a little bit more tumultuous on that side. And I think that just goes to show the importance of collaboration at multiple levels, right? This call today exemplifies that. We have medical and mental providers, mental health providers, as well as legislators. And I think at our state level, we also need to be highlighting the cooperation, the collaboration between our House and our Senate. So as people here back at home, as constituents, as advocates, as community-based organizations, we need to be mindful of things like that. So thank you so much for shedding light on those processes. I do have a follow-up to that question, and this could be for you, this could be for Rep. Powell, this could be for Amanda Nitrar here, who we have on the call. But we'll start with you, Rep. Abney. If you could implement one policy today that would dramatically improve mental health outcomes for Black families in particular, what would it be and why?
I would say, and this is sort of both a policy and a like implementation practice thing, because I'm dealing with this in my own district. I have um, a behavioral mental health service provider, like a private organization that is just a small shop, that they are the only private mental health and behavioral health clinical service provider in their entire zip code on the south side. But there is a credentialing process that they have to go through to get their staff to be fully credentialed to be able to take on Medicaid clients who need mental health services. And we know that this is a big issue because of everything that's happening at the federal level with the issues around Medicaid and how that's impacting people at a local level. But I think that there are providers in some of our Black communities that aren't able to keep up with the demand of the folks who need mental and behavioral health services for a lot of reasons. But one of the reasons is sort of the red tape of government of getting the approvals from the county and from the folks that the county is contracted with to actually go through the process to credential folks. It should normally take, between 60 and 90 days for that process to happen. But in my conversations with some of the folks that are providing these services, in my sort of trying to work with the county to expedite this, it's taking over 130 days, right, for people to get the credentials that they need to be able to provide the mental health services for people on Medicaid. And that just means that there's longer wait times, people can't find providers, and then they're either not getting the treatment that they need in our communities, or when they're getting the treatment, they're waiting until the very last minute and they're having severe issues and they're going to the emergency room, right? And that causes more strain on our healthcare system. So I think there's just this red tape of government, which I'm sure nobody on this call is surprised exists. But a lot of times in our communities, there are folks who want to provide the mental health services, but in order to be credentialed to provide those services through the county process for Medicare waiver reimbursements, it just takes a really, really long time. So if we can figure out a way to be more efficient and getting people's paperwork through, I think it will go a long way for folks getting the services that they need in our communities.
Thank you for that. Rep Powell, would you like to weigh in here?
Oh, absolutely. I know you said one, but I'm going to say two, if that's okay. Raising the minimum wage, full stop. I think it's incredibly important to ensure that folks have the um, money that they need to make the decisions that they need in their own lives. Agency is so important, and I know for so many families, it's oftentimes cutting what they can, whether it's foregoing, going to the dentist, or foregoing getting a new coat for their kid because they've got other bills that they're juggling. And so being able to raise the minimum wage is incredibly important. We've seen in other states, in Ohio and West Virginia, they've been able to do this without upending their small business landscape, as unfortunately is the argument against raising the minimum wage. We can do it. Other states have done it, and it has a tremendous impact on making sure that those who are most vulnerable amongst us have the agency to make decisions for their own health and well-being. And then secondly, I would say our Family Care Act. It's a bill that I've had the honor of working on with other legislators. And I know Representative Abney as well as a co-sponsor on this bill, but it's paid family leave. Again, giving people the ability to not have to pick if they're going to pay a bill or take care of a sick child, make sure that their rent is paid, or taking care of an aging loved one. Making sure that their electricity is paid versus fleeing an intimate partner violence situation. I am a huge proponent of these types of programs because for so many families in Pittsburgh and our Commonwealth, it's a paycheck that or the loss of a paycheck that deeply impacts their mental health. Giving people money and agency to make these decisions, I think, alleviates not even some of the stressors that they have on themselves, but their ability to seek help. Where again, if you're able to have time off and you need to go see a mental health professional, you can. Or give yourself that mental health day that you deserve and that you need. So these two policies implemented, I think, day one would have a tremendous impact on people's mental health, on their ability to make decisions for themselves and have that agency that we've talked about, and make for healthier, happier, and hopeful families.
Thank you so much for that. Sitting over here trying to think of ways to market healthy, happy and hopeful. So thank you. Amanda, I would like to open it up to you as somebody who ran for Pittsburgh City Council. You're also part of the experiences happening at the federal government level underneath Governor Josh Shapiro. What would one policy that you'd like to see implemented for Black families look like, and how do you think that could improve the lives and well-being across the state?
Yeah, thank you for that. I definitely have lots to say, but the first thing that comes to mind is, you know, as Representative Abney mentioned, a lot of the resources come from the county. So for people who are local to Southwest Pennsylvania, who live in Allegheny County, the county is responsible for actually taking those resources given to them and then providing them for people here locally. And so one thing I would love to see happen is changing the parameters for who qualifies for certain services. Right now, which I think is, not surprising to most people who are on this call, you have to make below a certain amount of money to get financial support for certain caregiver services or even other types of services. And so we have a situation where, like in the case of my family, right, we're a family of 5. That includes myself, my husband, my 2 boys who are almost 4 and 6, and then my mother who has Alzheimer's, and we care for her full time. So if as a household we make too much money, then I would no longer qualify for the financial support for my mother to qualify for adult daycare services, which means that I couldn't work at all. And my husband and I are already working part-time, both of us, because of the flexibility needed to provide care support for my 2 children and for my mother. And so we have a giant, what they call donut hole problem at the local level when it comes to being a parent when it comes to being a caregiver to a person with a disability, when it comes to caring for your aging parent or an aging loved one, where if you make too much money, you're actually at a greater financial loss and disadvantage, which we know, of course, contributes greatly to the overall mental health and emotional well-being of parents, of caregivers, of unpaid caregivers. And so that is a huge problem. And I would say locally, the biggest issues is budget, right? Where are we prioritizing where money is spent and how money is spent? Um, yes, we definitely need to raise the minimum wage. However, we need to pay paid caregivers. One of the greatest reasons why people cannot access childcare, cannot access care and support for people who are disabled, cannot access care and support for their aging loved ones is because we have a great deficit in the workforce of folks who are professional, who are trained, and who understand the nuances of early right childhood education, of how to care for someone with dementia, of how to care for people who are vulnerable. And so if we're not paying people, they're not going to do the jobs, or they're going to get burned out and they're going to leave and they're going to go down the street to work for, right, the role of a gas station attendant, because some of these places are paying them better than people who are in these caregiver roles. So we have to pay people better. Um, and then lastly, I will say, you know, a lot of the organizations who are filling in the gaps of where government can do better, right? Whether it's red tape, whether it's priority, whether it's knowledge or not, you know, schools. A lot of these schools are the ones, as Representative Abney stated, providing some of this support. However, if you can't get to school, right? Because you're a walker who's a student, or you're a parent who doesn't have a car, right? If you can't get to school, then you can't access the support and services. I know that here, where I live in Langley, there's a Mustang Market, which was created by a nonprofit led by a Black woman, right? Where people have access to fresh food in a place that is a food desert. Well, if they can't get to Langley to get the food, then they can't eat, which we know has a direct impact on the mental health of not just the children who can't learn, but of course, right, their family members. So mobility and access, knowledge of and education on what services are actually available to people. The number of folks broadly who know that I'm a caregiver advocate who call me to find out, where do I go for financial support? Where do I go for mental health support? Where do I go for resources? Because it's not being communicated in a way where people understand that they have access to these things, or even how to qualify for these things. The process of getting access to resources is so cumbersome. And so when you talk about communities that are traumatized, right, you're just adding another layer. And, you know, and I would be remiss if I didn't mention, I am speaking both from a person who's a sandwich caregiver and a person who's disabled, who is sitting at those intersections. And so my work is very much rooted in also disability advocacy. And the last thing I want to say is the reason why access to childcare services and support services for people who are caregivers to young children is so hugely important. Is that when you're in spaces talking about caregiver needs for people who are disabled, or for seniors, they often look to what has already been done in the childcare setting as a model for how to move that forward. So, you know, it's like, okay, look what we've done for childcare and childcare providers. We can now use that model to try to get people to understand that we need it broadly across the board for all caregivers. So this has a ripple effect on caregivers broadly, whether it's for young children or the other communities that I've talked about.
Thank you so much for grounding us in the various levels of caregiving. I think part of our due diligence today is to continue to shine a light on maternal health. And in addition to that, it's our fathers, it's our grandparents, it's our adoptive families who take on the responsibilities of raising infants to children. So part of the conversation today needs to be centered around what supporting a young child looks like, and what supporting the mental health of those taking care of these young children might look like. So I thank each of you for taking on the challenge of answering that question because it's a big one. There's not a one size fits all solution, obviously. We're going to have to try things that, may not work, but may improve the situation a little bit. Um, and this is going to be the last question that I have for you all that focuses on deficit, right? Because we have folks here in the community watching. We want to make sure people know that there are real solutions, real actions that they can take to improve the lives and well-being, not only of others as advocates, but for themselves. Um, so this question, I'd like to start with you, Representative Powell. Where do you see the single biggest gap in mental health services for Black families, and how is the legislature working to close them?
That's a great question. The single biggest gap. We talked a little bit, and I'm gonna, as you can tell, there's a theme. I'm not, there's so many, so it's hard to boil it down to one. But I mean, I think some of the biggest gaps that we face, um, and we talked a little bit about this already, is accessibility. Oftentimes, these supports are embedded in places that are already contingent on your ability to get there, your ability to pay for said entry fee. And so accessibility is huge. Um, One of the things that if I could speak from my own experience too, is still stigma. In my family, my sibling has had a long time mental health issue, and it while my parents were really good about ensuring that they had mental health supports and resources, it was often like a hush hush, kind of thing in my family, where my sibling was diagnosed with schizophrenia very early, 13. And my parents recognized very early that there was an issue, that they weren't emotionally regulating in the way that they thought, for a child their age they should. And again, my parents were recognized the issue, but when it came to aunties and cousins and titis, they were just like, they don't need any help. They need this, they need that. You just need to straighten them up. You need to, maybe they need to, like things that we know now are not helpful to people's mental health. Maybe they need more like spankings. Maybe they need XYZ. And so I don't say that this is for every single family, but I do think that, within our communities, there's still that stigma of seeking help and being open about it. Where as a family, we were really grateful for the supports that we received, in particular, NAMI, the National Alliance on Mental Illness, was a huge support, where my sibling was receiving supports, but also as family members caring for and living with someone with acute schizophrenia, we also were in therapy and had resources and supports as folks living in this family dynamic that was really complicated and was really tumultuous at times. And so access is important, but also making sure that we're treating these issues with kindness, with understanding and openness, and encouraging family members, loved ones, community members to seek the help and supports that they need without stigmatizing them, without making them feel othered, without making them feel less than. And just speaking from my own personal experience.
Thank you. I'll restate the question again because I know it was a long one. It's, where do you see the biggest gap in mental health services for Black families, and how is the legislature working to close it? Rep.
Yeah.
Abney will come to you.
Sure. Yeah, I'll build upon. I think Rep. Powell is exactly correct. We talked about the access, but also the stigma is still an ongoing challenge within our community. And to try to build onto that, I will also add cultural competence of the providers who are providing the service for Black folk. There are folks who will sit in front of us and have conversations that don't necessarily look like us, that don't understand our culture, don't understand our background, our family dynamics, that are trying to help us navigate all the challenges in life. But sometimes there could be a disconnect between the provider and the client that they're serving. And so one of the things that I would love to see is how we get more, and I'm biased because I'm a social worker, but how we get more licensed social workers who are Black in Pennsylvania. I have a bill. Well, there are two bills I want to talk about really quickly. One bill, I have House Bill 554, which is a social work interstate compact bill. It would allow for licensure portability for social workers in different states to be able to practice in Pennsylvania if we become a part of this compact. So, for example, if you are a social worker and you're licensed in Ohio and you're serving somebody, and then you move to Pennsylvania for a work opportunity, you are no longer able to provide that service to that person in Ohio, unless you then get licensed in Pennsylvania to practice, because we're not in the compact. And that is minimizing the amount of folks who, when they're looking to move from one state to another, looking at Pennsylvania as a state that they may be attracted to, because if they have a license, why would they in one state, why would they want to go to another state and go through the whole process over again when there's other states that allow their license to be portable, and as soon as they move to the other state, they can continue to work and continue to practice. So that bill is currently sitting in the Senate Appropriations Committee, waiting to be moved. So if there's any folks who want to do some advocacy, we can, encourage our Senate Appropriations Chairman Scott Martin to move that bill. I think that would help to attract more social workers to Pennsylvania. And then also, you mentioned the maternal health conversation a little bit earlier, briefly. I have House Bill 1212, which is the PA Dads Matter Act. As you saw, I'm a father. I've actually have another kid, 4-year-old as well. And part of what this bill, if it goes into law, is designed to do, is really will force the Department of Health to do an education campaign about the important role that fathers play in maternal health outcomes. And it would also work with direct care providers, maternal care providers, to educate them about how they can expand their programming, not necessarily for them to create new programming, but to give them guidance on how they can include fathers in the programming that they already have. The example that I always talk about is in both experiences when my wife went through her pregnancy, there was multiple occasions when we would go to the check-ins and I'd be sitting in the waiting room. And obviously, there's times where I should be sitting in the waiting room, but there's times I sit in the waiting room and she would come out and she would say, "Oh yeah, I just did a mental health exam." And I'm sitting there thinking, I wish somebody would have checked on my mental health. Like nobody asked me how I'm doing emotionally, mentally, going through this process. So I could feel like I'm included in what she's going through as well. And so this bill, if it gets put into law, it would encourage those providers to just be more inclusive of fathers and give them an opportunity to not feel like they have to be on the island by themselves or sit on the sideline. And so I think those are two things that we can do as a legislature, try to pass some legislation to hopefully, one, create more African American social workers or mental health and behavioral health providers, but also figure out ways that we can get fathers more included into the maternal health process.
Wonderful. Thank you for that insight. And then last but not least, Amanda, and then we will head to our last question.
Yes. So yes, I cannot echo enough the importance of having more Black providers. They are so scarce, and it has caused, I mean, we talk about mental health, the anxiety that Black moms in particular, Black parents feel about the lack of Black providers in our region broadly, and how everybody is all trying to go to the same person. I know that this isn't about mental health specifically, but like, for instance, with the passing of Dr. Adekwu, the void that we have felt in the community, as she was one of the few trusted Black pediatricians. She happened to be my pediatrician. And that, of course, highlighted the fact that the handful of Black providers that we have should not be carrying the full weight of the hopes and dreams of the community and their children, and making sure that they're raised in a way that where their care is centered and care is centered for them. And so I feel it's a crisis that we need to deal with because of the effects of what happens when we're seen by providers who don't understand the care that we need. More offices and access points for care. There are too many neighborhoods where those offices just do not exist. And we expect for people to travel to this neighborhood, to this region, to this section, to find access to care. So I'd like to see the prioritization of establishing more offices and access to care. And then lastly, statewide, I'd love to see continuity of care. So for instance, when I gave birth to my eldest at the midwife center, 8 postpartum mental health visits were baked into my care and offered to me by the mental health provider at the midwife center, which thankfully happened to be covered by my insurance. You're given 2, but you get additional if your insurance covers it. And so that is an experience that every single person who gives birth should have a right to, and should not be based off where you give birth or whether or not your insurance covers it. So I just wanted to add that. And also, of course, right, when the 8 visits are over, then who am I supposed to go to after that? And how do we make sure there's a warm handoff for people who need the continuity of care?
I think it's evident that all of these pieces, the gaps that have been identified, the potential solutions to correct those gaps, all fit into one big puzzle that is solving the maternal and child health, family health crisis that has to also do with mental health. So, for folks at home watching, please take into consideration each of these areas, as you know, they may affect you, they may affect your families and your neighbors. Um, and I think that's a really good follow up to the very last question. We'll do like a lightning round sort of thing to keep on time. Um, how can community members, your constituents, neighbors, friends get involved in efforts to move the needle on improving maternal and child health forward? Amanda, we'll go to you.
The quick and easy answer for me is I have tons of community leaders who are already filling in the gaps of what has been missing, whether it is access to care and support broadly through mutual aid, or growing food and providing food for folks where they don't have any. So what I would actually like to see is greater support for not just members of the community who is doing this great work. So it's not just a lot of Black women doing unpaid labor when they're already suffering and carrying the weight of caring for their own families, which unfortunately is what we too often see, especially hyper locally. And they're getting burnt out and they're dealing with their own mental health crises. And they're the ones who are stepping up. So I'd like to see greater support for them, but also, you know, if you see that there's an issue, um, there are many ways to get involved. So either it's reaching out to your representative, or reaching out to your schools, reaching out to your neighborhood associations, and just stepping up to fill in where you see a need, but also holding people who say they're leaders accountable to make sure that we get the resources so that it's not the everyday person trying to make something out of nothing.
Thank you. Rep Abney?
Yeah, I think also, hosting events like this, and continuing to have these conversations and don't let them sort of fall to the wayside. We want to continue to signal boost the importance of mental health services, maternal health, behavior health. All of these things need to continuously be on the forefront of people's minds, because we're in such a competition for people's attention and issue areas, that we can't allow these to get lost sort of in the proverbial sauce. And I think, as Amanda mentioned, reaching out to your elected officials and sort of paying attention to legislation that is moving, and sort of figuring out sort of the strategy and advocacy plan to make sure the right people are hearing it. That means calling into their offices, sending emails, doing letters. But I also encourage folks to do like op-eds, like reach out to your local papers, and see if you can get an op-ed placed, or a letter to the editor about an issue that's important to you, because it can get more eyes onto it as well.
Wonderful. And then finally, Rep Powell.
I think I would just close with, in addition to what the other panelists have said, I'm assuming if you're listening to this legislative breakfast that if you're plugged into Healthy Start, you are a community leader. I would say take care of yourself. We talk a lot about self-care. We talk a lot about making sure that you're not pouring from an empty cup, but really heeding that advice. I'm sure, again, if you're passionate about these issues, you are tapped in, you're meeting with your legislators, you're following legislation, you're working on policy, you're trying to figure out how to stand in the gap of services and resources, but take care of yourself, be kind to yourself. This work will consistently dull you, it'll consistently drain you, it'll consistently make you angry and make you scream into the void. But there's good work being done. You're a part of that good work. And take care of yourself so that you can continue to fight another day.
All right. Well, with that, I think it's safe to say that we are deeply grateful to our legislators and advocacy expert here for joining us today, as well as for your continued leadership and partnerships across the board. Your commitment to advancing policies and support for families and communities is truly invaluable. And I think today's discussion reinforced the importance of whole caregiver, whole child approach, which is one that recognizes the vital role of all caregivers in a child's life. I think that achieving this vision requires strong collaboration and sustained support from our elected officials, medical and mental health providers, community members, and leaders alike. Um, and I just want to wrap and say that together, your efforts are helping to build a more responsive, equitable system and care for our babies, children, and families across the state of PA. So thank you. With that, I'm going to pass the mic to Ms. Sonia Ford Gore, who is one of our proud and dedicated community health advocates and consortium members. Ms. Sonia?
Thank you, legislators and Bernasia. Again, I'm Sonia Ford Gore, a member of the Healthy Start Pittsburgh Consortium, and it's now my pleasure to continue this conversation with a testimonial from Ms. Sheena Howard. Ms. Howard, welcome to the Legislative Breakfast.
Come off of mute, Sheena.
I thought I did it. Sorry. Good morning. Good morning, everyone. I'm sorry. I thought I definitely hit it mute. Unmuted. My name is Sheena. I work for Pittsburgh Public's Teen Elect program. As my role, I serve as parents. Parents and teens who are pregnant. And my overall goal is about life changing to make sure our students have the resources, support, and guidance they need to overcome the barriers and standing in their way. And this work is deeply personal to me because I once was a teen parent myself. And so therefore I just don't advocate for them. I actually experience a lot of this stuff myself. And I know what it feels like to be young, overwhelmed, and trying to figure out parenting while trying to figure out life. And there were so many things I didn't know, and moments where I felt like I need to learn. I felt that I had to learn everything in a hard way. And the experience shaped me, allowed me to connect with my students in a way that goes beyond my job description. When I sit with them, I'm not just speaking as an advocate, I'm speaking a person who lived their experience. And what I see with our teen parents is they do the best that they can with what they have, the knowledge they've been given, their experience in life. You got some who actually utilize our program that helps navigate their own struggles. But whether they're confident or overwhelmed, whether they have a strong support system, none at all, I see their efforts. I see their love for their children. Many of our students are facing challenges that will break some adults. Lack of support, unstable family situation, financial stress, and everyday pressures of simply trying to survive. But yet they show up for themselves and their children. They keep going. I see the resilience. I see why our program matters so much to these students. We are trying to connect our students to the right resources at the right time. And we want to meet their specific needs, whether it's childcare, housing, mental health support, academic help, parenting, education. Our program gives them a place that they can learn and ask questions and be guided through realities of parenting while still being teenagers themselves. I know it takes a village to raise kids. And I know me as a teen parent, I had my family support, and I realized a lot of our kids don't have that support. So we are their support, and that's why it's just important for us to be able to connect to our kids on that level and their families, so they can have the proper support, so they can be okay for the babies themselves. we don't just give them information. We walk through it. We walk through the journey with them. We help navigate systems that can feel overwhelming for them. We advocate for them when no one else is, or they don't know how to advocate for themselves. And I do remind my students they are deserving. They deserve support, stability, and opportunity. And I always just try to give my examples of like little things that I went through. And just because of that, I feel like I'm able to connect with them. They're able to understand, like, I've been there, I lived it. And if I can help you, I want to help you any way possible, because it's hard being a parent. And on top of dealing with your own stuff that you might have, your own traumas, your parents' traumas, I think it's important to show our kids that we care and they have the supports that they need in order to get to the next level. And I also try to tell them when they grow, their children grow. When they access the resources, their children benefit from them, not just them, but they benefit. Their success is not separate from the child's success, is the foundation of all of this. And what I really, really, truly want for our teen parents or any parent, that they're not alone, that their story doesn't end with struggle, that they can break cycles, build new paths, and create future for themselves and their children. Nothing like challenges that they came from. I want them to feel supported, empowered, and be seen. I want them to know that teen parent does not disqualify them from greatness, and it does not limit their potential. It does not define their worth. It's a new beginning. And if we come together and understand as a community, if we invest in our teen parents, and then we're investing in 2 generations at once, and we are strengthening families, schools, and our future. And this work matters to me because I feel like I want to make a difference, and our student matters and their children matter. I need to, how important that is for people to know. Just because they're a teen parent, just because they're young, like, they have a voice just as well. And sometimes, like, the work that we do is needed because we give them an opportunity to do something different. It might not work for everyone, but it works. And like I said, like, I'm a teen parent. I come from Pittsburgh, Pittsburgh Public School graduate, and I did amazing things. I feel like they could do amazing things just as well. So our work is important, and with everything that everyone else does is important. And I just want to say thank you guys for having me and allowing me to be here and share my thoughts.
Thank you so much, Sheena, for that powerful testimony. I'm really, really moved by that. I got a little emotional hearing you just, regard our young parents in such a high manner. Their story does not end in struggle. And I think that is very important for them to know. So again, thank you for that testimonial.
Thank you.
Now, everyone, we're going to move into our provider portion of the panel today. So today we have joining us Dr. Stacy Bartlett, who is an assistant professor of family medicine at the University of Pittsburgh. Her work is focused on improving postpartum care in the community through integrating care for parents and their babies. We also have Dr. Maya Raghavan, who is an associate professor of pediatrics in the Division of General Academic Pediatrics. Her research interests focus on preventing intimate partner violence, IPV, specifically by supporting IPV survivors in pediatric healthcare settings and examining the impact of cultural and structural racism on IPV survivors and their families. We also have Dr. Arama Saki, who is a child, adult, and reproductive perinatal psychiatrist and the director of Women's Behavioral Health in PBHI. She believes that patients are the most important members of the treatment team, and teams should collaborate with patients to help them achieve their personal goals. And last but not least, to round out our panel, we have again Miss Sheena Howard, who has 14 years of experience across education, family services, and youth development, and brings a compassionate, strength-based approach to supporting children, families, and young parents. Her work is rooted in advocacy, meaningful relationship building, as you all heard, and a deep commitment to helping families access resources, stability, and opportunities they need to thrive. Thank you all for being here with us today, and we'll jump right into our discussion. I would like to start with a question for Dr. Bartlett. Birthing people are typically screened for postpartum depression up to 1 year postpartum, and non-birthing caregivers are typically not screened for depressive disorders at all. What supports would you need in your clinical workflow to successfully provide mental health resources to all caregivers?
Wonderful. And thank you so much for having me. I'm really excited to be here this morning. So yes, I would love to tell you what would be what would work for me. And I think the first thing is just as you mentioned, Cheryl, that screening should be inclusive. And I'm coming from the perspective of a family medicine physician, so I'm often taking care of the whole family. And so being able to do that for people who are perhaps not the birthing person, it would be huge. So screening that's embedded in the visit that doesn't add a ton of burden, that's just thought of as, part of what we typically do. We get your blood pressure, we get your heart rate, we, check in on your mental health as well. So I think that's the first thing I would say. The other thing is having more of a sort of warm handoff that I would be able to do to mental health providers. And so we've heard some mention of that sort of embedded mental health in primary care, in postpartum care, and I think that would be huge. So being able to have clinicians who are part of our practice, which my practice, thankfully, we do have both psychiatrists and therapists, but that's huge. So I can actually give someone to a provider, a mental health provider. I can introduce them. I can kind of share their story. They can sort of see that person is a trusted person for me. And then getting some feedback on that would be great too. So knowing sort of what happens and working in a collaborative way is what I find works the best. And then the last thing I would say, and this is more of a policy thing, is that we have to get paid to do that, which sounds maybe a little bit crass or a little bit like we don't want to talk about it, but most, I think, clinicians and physicians and social workers are, altruistic and they want to do what's best for their patients, but the system is not going to let us do it if we're not getting paid for it. So figuring out a way to get that work that matters so much be sustainable would be huge.
Thank you. Would anyone else like to chime in?
Yeah, I can just share. I completely agree with everything Dr. Bartlett said. Thank you so much for the opportunity to be here. I'm a primary care pediatrician, so I see a lot of families and babies. The one other thing I wanted to offer just in terms of like the clinical workflow is we need time, like we really need time to hear people's stories, validate their experiences, be able to sit and just listen and not be staring at our computer or running to the next patient. And to Dr. Bartlett's point, right, like that time needs to be considered important by insurance companies and by our healthcare system. And right now I fear it's really going in the opposite direction in terms of time. And so I just wanted to mention that from a policy perspective, when we think about like the amount of time we get per visit or what is reimbursed, because it's not fair to patients who are like courageously sharing their stories with us, for us not to be 100% present, listening and validating for the amount of time that they need. And so I just wanted to add that in addition to everything that Dr. Bartlett said.
I agree. There's nothing like, having a serious issue that you want to discuss with your doctor and they're like, rushing through your visit and, on to the next. And you're like, well, I guess I got to schedule another appointment just to even finish the conversation. So I appreciate that. Thank you. Okay, so we'll move on to our next question, which this is for Miss Sheena Howard. Adolescent parenthood is associated with a range of adverse outcomes for young parents, including mental health problems such as depression, substance abuse, and post traumatic stress disorder. How can we support mental health care for teen parents, particularly when their parents or guardians may act as a barrier to them accessing services?
I would say providing a safe space for them. If you're able to connect with them and talk to them, I feel like you might get a better result. And it is very difficult when you don't have the parent support because they have to sign off, they have to do other things. But patience, you got to have patience and holding their hand and walking them through the process and show them that I can be that support. Like, I know I can't sign off on stuff, but I'm not support for them. And this is what the process. And I always try to really fully explain it to the parents if it's able to. If your kids is good, if your kids is good, then your grandbabies could be good, and you could like it. It shows like it's important to really explain the why to them. Why like your kid needs this mental health services because it will be there will be a better parent for their children, for their grandchildren, and we have better outcomes.
Absolutely, absolutely. Would anyone else like to chime in? I'm definitely interested in hearing from the doctor perspective when we do have young people who are parents. What types of barriers will they face in accessing mental health care? Now that they're in that role of parent themselves, but yet their parent or guardian still has to um, give permission for various things.
So when teens are 14 years and older, they can consent for their own voluntary outpatient and inpatient care for psychiatry. So that does help. Luckily, the vast majority of teens that we have referred to our clinic, their parents have actually brought them. And so it is helpful if there's no abuse or neglect from their own parents to include family as much as possible, because family does know family history, they know medications that kids might have taken, they can help us resource or get IEPs or 504s, which can give us a greater picture as to what's going on. And, people who experience perinatal depression, anxiety, and whatnot, there's a huge component that is genetic. And so we can find out, is there a family history of this? And a lot of our parents who come with their teen moms, they might tell us, I experienced this myself. And so sometimes when there's a barrier, there might be a sense of, we have to provide education for the entire family. There might be a sense of, I experienced this myself. I wish I had this care. How do I get care now? So sometimes we have to pull family aside and say, maybe it's the time that you access your own care. So I think really when we're able to pull in family as much as possible and to collaborate if there's no neglect or abuse, that can really help. So it really just takes education and figuring out, what does this mental health illness mean in your culture, as someone said before? What does getting treatment mean? What does this mean for your family that you have to help with medications and babies and whatnot? So really being curious as to what's going on behind that, rather than saying, okay, we need to separate or divide you.
I love that. As you were speaking, it did make me think back to when Rep Powell said, stigma, especially in the Black community, there is a lot of stigma around mental health, and that's historic, for generations and generations and generations. Women, especially, have been given that title of strong Black woman. You can handle it. You're supposed to do this and that and take care of yourself last. And we know that, that has detrimental effects to ourselves and our families as a whole. So I really appreciate that. It really just made me think stigma, stigma. A lot of people will say nothing's wrong with you, go eat, get on with your day and keep it moving. But for some of us, that's absolutely not true. Okay.
Is it okay if I share just one other thought? Do we have time?
Yeah.
I totally agree with what everyone has said. I just want to, this is one of the things I've noticed about healthcare is it's not very facile when it comes to technology and just like technological innovation sometimes. And so as an example, I know a lot of like young adult and young patients really like texting, or they prefer to communicate through social media. And we don't, in healthcare, we don't always have the ability to do that, right? So we're trying to call people to schedule an appointment. No one's picking up their phone, right? They're in school, they're at work, or just that's not how they communicate. And so I think really trying to like thoughtfully and intentionally figure out the best way to communicate with young people so we can get them access to healthcare, to mental health care, is really important. And then the other piece is, like, I know a lot of my patients will tell me that they get their therapy on like TikTok, like they watch TikTok videos of therapists. And I know sometimes in healthcare, like we're a little dismissive of that, but I don't think we should be, because maybe this young person has found a culturally competent therapist on TikTok who's really speaking to them. So I'd really love to think about ways we can partner with people that are like on TikTok or social media who are, who young people are watching, and like be able to find people that really are able to support young people's mental health. So just kind of like more being able to be more facile with technology and social media, I think will be really important too.
Definitely. I mean, you like, as care providers, you have to transform with the times. A lot of our paperwork is digital now. There's not a lot of offices who have physical paperwork that they're doing with patients. Everything is electronic. So you definitely have to transform with the times if you want to meet people where they are. So I think that's a great point. For our next question, this is directed at Dr. Saki and Dr. Ragavan, and also anyone else can answer. Many clinicians know that caregivers' mental health is one of the most important factors influencing children's development. So, in your opinion, what would an ideal coordinated system of care look like for supporting both caregiver mental health and child development from pregnancy through age 3?
Yeah, that's a great question. I think it would be coordinated in terms of not just involving, psychiatrists, therapists, pediatricians, but really looking into child development that's going on for caregiver as well as baby. There are a lot of really great programs that look into a strength-based model. We have Circle of Security parenting program here, which is a group that allows parents to kind of look at their children and to say, how do I figure out what their needs are, and how do I co-regulate, like where I'm feeling anxious or depressed and maybe they're having a meltdown, how do I help them navigate through that? How do I try to heal from my wounds of being parented so that I can parent in a way that feels true and authentic to me? We also have a maternal infant health program here that helps parents to figure out, what are you doing well, and what are some of the things that you can continue to do with coaching or learn how to do that you haven't done before, you weren't maybe taught how to do. So I think it's really important to have many different people help people figure out how they want to parent. It's really important to figure out, we have birthing plans. What is your parenting plan? What does that look like for you in terms of achieving your own goals as an individual as well as a parent? So, and that can always change. Figuring out with people, like, how do you grow and develop with the supports that you have in a way where we're not penalizing you. Or I think a lot of people are really scared about calling CYF if they ask certain questions. And so creating a very supportive environment where we allow people to make mistakes and to grow.
Yeah, that I resonate so much with all of that, Dr. Saki. I completely agree. I think that the way that well child care, and for all of you who have kids, you know this, right? The way well child care is right now is like, you go to the clinic, you see the doctor for 15 minutes, you get your shots, you leave. Like, I want to radically transform that. So it's all centered on the family, and the family will get access to a community health worker, a family coach, and then of course the healthcare provider if there's any medical issues. But I would love to really see well child care amplify community health workers, postpartum doulas, peer coaches, family navigators as the people that are like the trusted supports for families. And I think that there just needs to be investment in those individuals. And I know, sometimes people will say the money's not there. Like the money is there. It's someone said this earlier. It's how are we prioritizing the budget, right? Where are we putting the money? And so I think that's really critical. I also, Dr. Bartlett had said this earlier about warm handoffs. I think that's really important. And I think it's really important in sort of an ideal coordinated care world, like physicians and healthcare teams need to have training in community engagement. Like from the beginning, medical students need training in community engagement. I feel very lucky to be able to partner with Healthy Start, and I know folks at Healthy Start. So I've had patients where I've been able to connect them directly to someone at Healthy Start. I had a patient where baby wasn't gaining great weight. There wasn't mom unfortunately didn't have a lot of social support, and I connected them with someone at Healthy Start and early intervention, and they've been really helpful for this family. And I think that making sure that there's built-in systems for warm referrals is really, really important. And we have that for subspecialists, right? If a baby has a murmur, I connect them to the cardiologist. Like, why don't we have those same systems for our community experts and individuals? So I think that's really important. I talked a little bit about time. I'm just going to say it again. I think that's really important. And then the one other thing, sorry, I'll go on and on, so I will edit myself. The one other thing I want to say is I wish there was better systems integration. Like I wish that it was easy for me to talk to a child's teacher about what's going on at school, that it was easier for me to be able to talk to some mental health professionals that are in the community. Like I just wish that communication between systems really centered the family a little bit more than it does now. So I think that those are all those are all big changes, and it'll be long work, but they're feasible changes. They're things that I think these changes will really support and empower families and put families first and center in the healthcare system, where right now I don't always think that's the case.
Absolutely.
Mind
Absolutely.
if
Would
I say
anyone
something
else
to
like to
Cheryl?
chime in?
Okay, sorry. Do you mind if I say something?
Sure, sure.
Okay, awesome. Yeah, this is something I feel really strongly about as a family medicine doctor, and how do we do that care from the pregnancy period. So I'm a family medicine doctor who does prenatal care and takes care of adults and infants as well. And I help run the Implicit Network, which is we're in 12 different states. We've got about 35 practices, and we do mini visits for mom or birthing person at our well child visits for the first 2 years, because we know from all of the data that people will bring their babies in for care, but they don't always get care for themselves in that time for various reasons. It's a very, very obviously very busy time. There's all the things we've talked about before, transportation and childcare and caregiving for other folks. So anyway, so we do these little mini visits for our parents, and they are very quick because, to Dr. Bergman's point, we do not have a lot of time. But we find them to be very, very meaningful. And because we're seeing both the parent and the child, we can actually, if we're going to do anti-anxiety meds, we can do that. If we're smoking and want to quit, we can give them resources for that. And we see them for years and years. I usually was seeing them before they got pregnant, and then I'm seeing them after they're, while they're in their parenting phase. And so I think, when you think about sort of continuous care, and, I'm a big advocate for dyadic care, so having baby and parent together. And then, as everyone has mentioned, just sort of rooting that in sort of community and being able to be responsive to that, and have people who we can do those sort of warm handoffs to build that sort of net, and build that sort of warm hug around, as Dr. Ragavan sort of alluded to, all those people who we would like to be able to have as part of it. But I really do want to sort of advocate for that family model of care as well.
I really, really appreciate you all, answering that question in that way, because as a family medicine doctor, Dr. Bartlett, I think it's really a cool thing that you have cared for some of these parents when they were, teens themselves and moved into their parenthood journey with them. And that kind of makes me think about Dr. Udaiku, as Amanda Nietrauer answered, because a lot of her parents were children in her practice as well, who she has seen, who she was able to build a relationship with because she had that time. And I think, like you all said, time is the most critical. It's really hard to build relationships with people in 15 minutes or less every 2 months. So it's like, okay, you done seen about 50 patients from the last time you seen me. What really could you know about me, and why should I really trust you, like you said, Dr. Saki, to not call CYF on me if I tell you I'm experiencing some extreme mental health symptoms. But I also want to say there are lots of programs like home visiting programs in the community, in the county, that also need to be in that integrated system of care that you mentioned, Dr. Ragavan, because those are programs that really stay with families for a year, 2 and 3 years, and they actually do have an opportunity to build a very close relationship with our parents in a way that some of us can't even imagine. So I think there needs to be a way that we could figure out how to make sure our parents are aware of those things and encourage them more to utilize those type of programs in the community, because it's just another way to provide some wraparound care, because the parenting journey is complex, and the less you know, the harder it could potentially be for you. So moving on to our final question, and this is for everyone. Whenever you hear the phrase whole caregiver, whole child, what does that mean based on what you see with families? How does that resonate with you all? Whoever wants to go first, just jump in.
Yeah. Okay. When I hear that phrase, I just feel like as one. So if mom, dad is good, child will be good. I think it's not just focusing on just the parent or just the child. We're focusing on everyone as a whole. So like I said, like if the parent's getting the proper care, if your child's getting the proper care, if they're not getting care at all, then it's a full circle to, in my opinion, what I see with our kids, even with myself and my kids.
Yeah, I will say, when I was in medical school, the very first research I did was with a group who was looking at the impact of maternal depression on child development, within the first like 4 months or so. And that's what made me want to go into med school or want to go into family medicine. That's what made me want to do what I do now. And so seeing the impact of specifically the mental health of parents, I think, on our kids, because I think the child's development is really just like, you can't separate that from caregiver well-being. I just think there's so much evidence that is so important in shaping children, and I do think that other part of that whole whole child, whole caregiver, whole child is that the caregiver should be an integral part of my visit with the child, because that's they're sort of a patient in their own right. For me, usually literally they're my patient, but also just their if my goal is to make sure that this child is getting the best chance that it can be, then I have to pay attention to how the caregiver is doing. It's just, you just can't ignore that.
I agree with everything being said. I think when I think whole child, whole caregiver, I prescribe meds to parents who are experiencing perinatal mood or anxiety disorders, but the medications alone are not enough. So what are other things that are not literal medications, but figurative ones? Like, do they have good nutrition? How's their sleep? Housing? Do they have access to green spaces? Finances? Safety? And so I'm thinking, like, we have to think holistically about patients, and that they can't get better emotionally or physically or health-wise if we're not thinking of them in their totality, and then that translates to them being able to provide as caregivers as well.
Yeah, I totally agree with everything. I think I'll add, two things to really think about kind of all of the trusted adults in a child's life and supporting them. I know previously there was a lot of discussion about making sure we're supporting fathers, grandparents, like all of the trusted adults in a child's life. I also think it's really setting up healthcare systems to think about, the whole family and not just an individual patient, which Dr. Bartlett was talking about. But just as an example, in pediatric settings, it would be really amazing if we had behavioral support, like if we had mental health care support for the caregiver too, right? Like we have often will have like integrated behavioral health for the adolescent or for the child, but it would be wonderful if a caregiver says to me, if they are experiencing postpartum depression, rather than just giving them a resource list, right, I'm able to connect them directly to a therapist that's in my office. So I think it's really just remembering what I think Sheena had said, which is like if the caregivers are well and healthy and surrounded by love and social support and kindness and joy, right, and are thriving, then like their kids will be the same. So
Absolutely. As a child who grew up with a mother who suffered from extreme depression, it is definitely vital that we are ensuring that our parents are well cared for so we don't continue to see the deficits that we see amongst, especially in the Black community, because of that stigma. Because of the mistrust, because of the outlook that no one really cares about what I'm going through. I'm just a number to my doctor. I'm just a patient. They're in the room for a few minutes and they're on to the next person and they're going to forget about me. So I really appreciate you all sharing your perspective, giving us such insight that only you could provide. And it's been a great conversation. So with that, thank you all for joining us. And now we will move into the question and answer portion of our program this morning.
Thank you so much, Sherelle, and thank you to our keynote speaker and all of our panelists, inclusive of our providers and our legislators. Thank you so much for sharing your experience, your expertise, and your perspectives. We are going to now open this time to questions and answers. So to our viewers watching from YouTube or watching from Facebook, please feel free to throw in the chat some questions for our legislators and providers. And we are going to move through it right now. We're going to start with the first question. Ms. Netrier stated insurance covered 2 mental health postpartum visits, but some insurances will cover more. Is this the standard for Medicaid as well?
So here's what I do know. I do know that in 2022, there was an expansion of postpartum services for folks who use Medicaid from 6 months to 12 months. I'm not entirely sure if that, include it said it included mental health because the target was to lessen the impact that would lead to death, right? Whether it's from mental health challenges or other issues, including racial disparities. Now that was 2022. Now we also know though that the current administration has done a lot of unfortunate rollbacks that will take effect now and some won't take effect till later. I don't know exactly how that will or has touched postpartum support, but I will say that this is another reason why, like Representative Abney said, it's important for folks to do what they can to pay attention to what is happening legislatively, and to try to advocate themselves as much as they can.
Thank you so much for that. The next question we have is, Dr. Ragavan shared an interest approach to connecting within the school system to support teen mental health. Are we seeing an interest within policy, insurance coverage that address this concept?
I would actually love to hear what my legislative colleagues have, if they have any thoughts about that. So I'm not entirely sure if there's any specific policy right now around like a healthcare school integration or systems coordination. So I'd love to hear their perspectives, or if anyone else knows.
Rep. Fiedler, are you still here? And Amanda, if you have any response.
I will just quickly respond on the hyperlocal level. So where I live, Langley is a school that is mandated to follow a community school model, which means that there's supposed to be strong partnerships between all the school administrators, the board, all elected officials who represent that area, business leaders, and healthcare providers. And so there's a huge opportunity, for instance, when that is the case, for there to be stronger partnerships to be built between people who do have that direct impact on the lives of the students. Because the whole point of the community school model is, how are we all contributing to the overall care and well-being of the whole student? So I can't speak to what is happening there now. I do know that that school in particular has great champions as teachers, but I do know that they could do with much stronger outside partnerships. But there's a strong desire, for instance, in that particular institution to do kind of what you're talking about, like how can healthcare providers do more of that? And I'd love to see that model really replicated for all schools, not just in areas where there's, quote, hardship, right?
Thank you so much for that. Our next question that we have, what does collective collaboration between healthcare providers and policymakers look like in practice? And how can partnerships like that go? Yes. What does that collaboration look like? I can also restate the question if need be.
Okay, I think I understood what the question is, right? But I don't know the answer to it. I don't know. I think we have a lot of work to do in that space, but I do think that events like this are a great place to start. Full disclosure, Dr. Ragavan and I have been texting on the side, like, that's a cool idea. That's something we should be like pushing for. Like, that's awesome. Why aren't we doing that? So I think having things like this super, super helpful to bridge that gap. But yeah, I would love to hear others' thoughts about how we can make that better.
I know I do, and I'm curious what let my legislator colleagues here think. But I think like many healthcare providers, I try to do a lot of advocacy both in DC and Harrisburg, and I know what I've been told when I've met with folks is that me being able to like share the voices of patients and like kind of real world what's happening has been helpful. So I think I was advocating around like SNAP and WIC reauthorization and just like sharing stories around like how important SNAP and WIC are, and has been really helpful. So that hopefully like that partnership, because I think we can bring different components like in terms of frontline stories and then like the policy pieces, and then kind of like be able to merge them together. So I think that I think being able to kind of I think it's really important for healthcare providers to know their representatives and to advocate as much as possible, whether it's in person or on the phone.
I agree. I think there isn't enough dialogue into what does your day-to-day practice look like and how does it impact your patients. And so I would love to talk to more representatives about that. I think when policy is made, the right people aren't always at the table, including patients, providers. And so like we do have to include those two people, those two groups, and to figure out like how to best do things. And I think it's not just with policymakers, it's inclusive of like in hospitals, like our flow is also impacted by people who don't always know what our day-to-day looks like. So it's communication.
I'd just like to add quickly from the perspective of someone who served on 2 state commissions and chaired a local commission. I cannot overstate enough how few people understand the connection between health, overall health and policy, and overall health and also what is voiced as priorities by our elected officials and people in leadership positions. Whether it is the maternal health crisis, and raising that locally and making sure people not only understand services, but what are the effective services provided that have led to greater outcomes, all the way to the wins, right? With the Momnibus, which was very intentional about making sure that service providers, people who are caregivers, right? People who are birthing people, all of those folks with legislators all came together for community discussions and forums, and we're very intentional about having all those folks at the table. And I can say that right now, the committee that I serve on for the Office of Alzheimer's, Dementia, and Related Disorders has that same coming together of folks like myself from the community, healthcare providers, legislators, and also the people who work in the industry that provide care to folks. So I feel like this is a newer thing. And by doing this, folks at the state level, right, they're learning about why these things are important and who is still missing from these conversations. And just one quick example that I'll give, as a sandwich caregiver, which is much more common, my son, my youngest was 5 months old when my mom came to live with me. So a lot of people don't understand, for instance, the connection between me not having access to care for my mom and my mental health and the impact on my very young children who were both under the age of 3 at that time, and vice versa. Not being able to access quality childcare and how that's taking from my ability to support my mom, which of course, right, had that impact on me. Had I not been at those tables, that's a conversation that would not have been had, which is why caregiving is caregiving. And no matter where you are in that system, we have to elevate it as being one of the most important points of support for everyone across the Commonwealth, no matter where you sit at the table.
Thank you so much for that, Amanda. We are going to end this Q&A with one final question, and that is, what does success look like for families if we get this right? Anyone can take it. I see some heads moving and shaking, but you're on mute.
I'm doing this so my kids don't have to go through what I'm going through now. And I'm doing this so that I can see more Black women and Black parents and Black caregivers and Black birthing people thriving and see our babies thriving. So I'm doing it for the next generation. And I'm excited and heartened by these conversations.
Thank you so much, Amanda. All righty, and we are going to end Q&A here, and we are going to hand it off to Jada and Sherelle to wrap us up.
Okay, thank you everyone for a phenomenal 2 hours that was full of information, inspiration, new knowledge, education on what is going on at the legislative level, what's going on in our community, what's going on with us personally. What are some of the personal struggles and the lived experience that comes into the space, whether you're a legislator, whether you are a sandwich caregiver, whether you are someone working with youth, or whether you are someone that's still dealing with some of your own personal challenges and triumphs around caregiving, because it can be, beautiful when we think about bringing a child into the world. And then, it can be challenging when we think about what it looks like to wind down in our last days and to do that with dignity and respect. So I learned a lot. A couple of my takeaways are the importance of normalizing mental health care, particularly in the perinatal period. Caregiver health is mental health. and increasing awareness of perinatal mental health disorders. Just want to make sure everyone is aware of our 988 line, which is a mental health crisis line. That is a number that everyone should know. If you don't know it, if you've never heard of it, or if you just needed a refresher, 988. That is an open line that anyone can call to get mental health support. Understanding that while there is so much that is going on in our Commonwealth to support families, moms, children, sometimes we're lagging behind, and we can do something about that. So it was good to hear from one of our own legislators that we can do better in the Commonwealth of Pennsylvania. We have a lot of strength. We have a lot of great initiatives. We have our governor who supports this work. We have the PA Black Maternal Health Caucus. We have the Momnibus. We have winning legislation, the Crown Act, but we can still do better. How social determinants of health impact caregiving. So Rep Abney talked about transportation, fatherhood, mental health. Mental health is a community concern. Caregiving is a community concern. And then lastly, I was really touched by those who are caregiving in schools, those who are taking care of our children when they're away from their parents, their guardians, and their primary caregivers, and what influence that those very important people have who are caregiving for our children all day, every day, from childcare providers on up to high school. It's really important work. I want to really quickly give a shout out again to the Commonwealth of Pennsylvania, who has invested $3 million over 3 years in supporting better access to perinatal, mental, and behavioral health services through a grant that they've given collectively to our 6 Healthy Start grantees across our state. Healthy Start Pittsburgh is one of them. We are the primary grantee, and we are working collectively with our other 5 sister grantees in the state of Pennsylvania to improve access to behavioral health care for our perinatal population. And lastly, I want to make sure everyone knows that April is the month in which we celebrate Black Maternal Health Week from April 11th through the 17th. This year's theme is rooted in justice and joy. And so I hope that you leave this legislative breakfast rooted in justice and joy, and can carry that right on into your observance of Black Maternal Health Week. This is a national observance, so we have things, of course, going on in our Pittsburgh community, and Healthy Start is committed to supporting those things that are going on in our community, but also you will find things going on nationally. So I want to leave you with 2 questions before we transition to Sherelle, which is, how are you practicing self-care as a caregiver, and how are you supporting self-care for another caregiver? Thank you. Sherelle?
Thank you so much, Jada, and thank you everybody for attending today. Thank you all to our legislators and our providers for continuing to be boots on the ground for the people who depend on you most. We know that it's not easy, and like Rep Powell said, please take care of yourselves as well. And for the folks watching, we appreciate you for being here. I also want to encourage you to share this with any parents you know, anyone you know who is a caregiver, who may be struggling a bit, who are not sure where they could go for help, who are just existing. We know that community is the best thing that we could give to other people. So I encourage you to build community with someone else. Send this to them so they know that they are supported, and so that they know there are providers and legislators and folks like the people at Healthy Start who are on their side and who are working hard for them to be heard, to be served, to live a life that is, not rooted in struggle. So again, I want to thank everyone for being here. We appreciate you, and we send you well wishes into this weekend and into the future. Thank you.
Okay.
That was great. Sending everyone a virtual mimosa, be it alcohol